Welcome. Carpal tunnel syndrome. I'd like to share another great self-help video for you. Hopefully something you've never seen, but so simple. What is carpal tunnel syndrome? Basically, it's interference with the median nerve. The median nerve runs underneath the flexor retinaculum, as you can see right here. That flexor retinaculum attaches over several tendons as well as vessels, arteries and veins. And that median nerve, from repetition of typing, using our arms, using our fingers, repetitive motion, which many of us do on a regular basis, there becomes inflammation, irritation along those tendons as well within the flexor retinaculum, within the area that can cause potential scar tissue. So the technique that we're going to do is basically going to stretch any particular adhesions that are being placed in the area. There are two tests that we check for. One is called Tinel's sign. We can just take a little reflex hammer, or you can use the tip of your finger, tap over the flexor retinaculum right here, and if the area is inflamed, you'll get radiation of pain or tingling into the hand. The other one is called Phelan's sign. We flex both hands together, put them together, hold it there for 20 seconds. If you get more symptoms into the hand, that's another positive sign. Although there's a lot of subjectivity in carpal tunnel syndrome. A lot of it can just be tendinitis or local inflammation that really is not a true carpal tunnel condition. Understand that this technique, what we're going to do, very simple, is to stretch that scar tissue. So what we'll do, take your thumb and put it right over the palmar aspect, lower part of the hand, over the lower part of the hand near the flexor retinaculum, which is right here. And all we're going to do is we're going to hold it tight as we push down and bring the hand backwards. And as you bring it backwards, watch my thumb as I slide down over that flexor retinaculum. Good, I'm sliding right down. You're going to do about 5 or 6 of these. Push down hard as you bring your wrist backwards, and you'll stretch that whole retinaculum area. Now do the same thing, and as you push down, go back to the thumb side. Good, so you get a different ankle on it. Beautiful. Back to the thumb side. Do 5 or 6 of those. And after that, you're going to go to do the same exact thing, flexing it back, but you're going to go to the little finger side as you go back like this. And you'll feel a different angle of that flexor retinaculum. The whole key here is we want to open up and stretch that scar tissue or adhesions that are presently in that involved area. That's such a great technique. Why? Because it's overlooked. And basically what we're doing here is most people will generally support it, put it in a immobile type of support. They'll just tell you to use ice, take anti-inflammatories, maybe even give you corticosteroids or injections. The bottom line is if you have scar tissue and you don't release those adhesions by pushing that area down, as you pull down and pull back on the wrist with the thumb, as the wrist goes in the opposite direction, we're going to do these going straight back. We're going to go back towards the thumb and back towards the little finger. You can do those on a regular basis. Do it twice a day. As long as you're not getting any radiation of pain or the problem is not persistently getting worse, then you can do this technique. I think it could be very helpful for you. Again, if you have questions, leave your comments below. I ask you to share this video with those who can benefit. I'm sure many people out there can, because of the fact we're always using our hands, typing, texting, writing, hammering, fixing things around the house, just doing things every day. And this can cause a lot of adhesions and problems in that involved area. And I ask you to subscribe if you haven't as well, because I'd like you to receive the best of self-help videos here on the internet. And most important, make it a great day. I'm Dr. Alan Mandell.
Thank you.